Hi, my name is Doreen, and I'm one of the clinical leads on 5 North, and what we're doing here is teaching the CAPD process. So, what we need to do first, when we do the checklist for 5 North staff, review the MD's order first. So you're going to confirm that dialysate, dextrose, and electrolyte concentration. Make sure that the concentration is what the doctor ordered. Any additives like heparin medication to be added into the dialysate, or volume of dwell amount if it's 1 liter or 2.5 liter, and the frequency of exchanges in a day, which is it could be 3 times a day, 4 times a day, 5 times a day, or every 4 hours. Just make sure you confirm that with the doctor. Now, what you need to do first is obtain before, during, and after treatment is needed the vital signs, weight, the INOs, the current lab results. Make sure you assess their lung sounds, their heart sounds. And last time the patient had a bowel movement, the condition of the peritoneal dialysis catheter site and dressing, any discomfort noted by the patient, check the effluence color, clarity or fibrinogen. The effluence color should be about clear yellow, and patient tolerance to treatment, you need to know about that. And then after everything is done, document the INOs and record in the Cerner. Okay, now the next step is to gather the supplies. You're going to have the ultra bag, and you would want to gather at least two or three bags so that you'll be ahead of your game. You're going to have 2 of the clamps, then you'll have your mask and your gloves, and your disconnect caps, which is also known as the mini cap with iodine solution in it. And then you'll have your weighing scale, your heating pad, and finally your IV pole.
Remove ultra bag from the pouch. Inspect the pull ring, tubing frangibles, and new solution bag for micro leaks. Make sure the ultra bag must be heated at least 37 degrees Celsius. Make sure the weigh scale is set to 0 by pulling up or down on the top. Hang the new solution bag on the weighing scale to get the pre-procedure weight. Exclude the weight of the drain bag. Hang ultra bag on IV pole. Place drain bag on floor with clear side up. Break the blue frangible on the patient connector end. Clamp the fill line using the first clamp. Then break the green frangible near the solution bag. Open clamp slowly to prime the tubing from the fill line until the solution reaches the blue frangible in the patient's connector end. After priming fill line, clamp again, then clamp your drain line with second clamp. Remove transfer set from patient's clothing. Make sure the transfer set is closed. Wash your hands thoroughly. Wear gloves. Wear mask, one for you and for the patient. Remove the pull ring from the ultra bag. Remove the mini cap and connect. Open transfer set to drain. Unclamp the drain line. Allow effluent to drain for 15 to 20 minutes. Evaluate drainage or effluent for clarity and color. Note any fibrin, which is a jellyfish-like mass, in the drain bag. When drainage is complete, twist transfer set to close and clamp the drain line. Weigh the drain bag and make sure the scale is set to 0. Open transfer set to fill and clamp the fill line to infuse a solution into the patient's abdomen. To cap off, apply gloves and mask. Clamp fill line, then twist transfer set to close. Obtain the mini cap. Make sure a spare or two are available just in case you drop one on the floor. Open the mini cap aseptically. Disconnect the ultra bag from the transfer set. With the transfer set pointing down, point the mini cap up and twist until secured. Discard the used supplies. Empty the drain bag in the toilet, then place it in the red biohazard bag. Document in Cerner.